So this PowerPoint is about Orem's theory of self-efficacy and how it influenced the care of a patient with rheumatoid arthritis, or RA. I'm Lori Cummings, and this is for DNP 634. So our patient's name is Marjorie. She's an elderly patient. She lives in an assisted living facility, and she has intermittent flares of rheumatoid arthritis. Rheumatoid arthritis, or RA, is an inflammatory and autoimmune problem which causes inflammation, painful swelling of the joints, and it can affect the joints all over the body. Marjorie was having a lot of pain this summer from her rheumatoid arthritis, especially in July. She was rating the pain as an 8 or a 9 out of 10. And she also found that because of her symptoms, she had reduced mobility and she couldn't use her fingers like she wanted to, so she couldn't do her crafting, which is something she really loved to do. So between the pain and not being able to do her crafting, her quality of life was going down. Her condition constituted what Dorothea Orem, the nursing theorist, would describe as a self-care deficit. Orem's theory of self-care includes self-care, which is the practice of activities that an individual initiates and performs on his or her own behalf to maintain life, health, and well-being. Self-care agency, which is the human ability or the ability for engaging in self-care, conditioned by age, developmental state, life experience, sociocultural orientation, health, and available resources. Therapeutic self-care demand, which is the total self-care actions to be performed over a specific duration to meet self-care requisites by using valid methods and related sets of operations and actions, and self-care requisites, which include the categories of universal, developmental, and health deviation self-care requisites. Aspects of Marjorie's problems touched on the meta-paradigm concepts as defined by Orem's theory, which in Table 13.1 of our text, the master's text, highlights the person or patient, a person under the care of a nurse, a total being with universal, developmental, and health deviation needs who is capable of self-care. When Marjorie's rheumatoid arthritis is controlled, she can perform most self-care activities. She actively participates in the crafts that she loves and in social activities at her assisted living residence. She suffers from mild dementia and memory loss, which necessitates her being in an assisted living so she can get her needed medications when they are scheduled and not forget to take those. She also needs some light housekeeping help. Environment is another aspect of Orem's theory, and this is the physical, chemical, biologic, and social contexts within which human beings exist. Environmental components include environmental factors, environmental elements, environmental conditions, and the developmental environment. Our patient Marjorie is in an ideal environment to support her best level of function. She's able to do as many of her activities of daily living as possible, and she gets the help she needs to take her medications as ordered. Enriching social, cultural, and artistic activities are available at her environment. Some family members are also nearby and add to the social environment of Marjorie's life. So in the Orem paradigm or meta paradigm, health is a state characterized by boundaries or wholeness of developed human structures and bodily and mental functioning. Marjorie has dementia and some memory loss, which is a cognitive limitation to her health. Despite this, she has a positive outlook on life and only becomes discouraged when she cannot participate in the things she loves, like crafting. Her rheumatoid arthritis and joint dysfunction keep her from doing her crafting as she would like to. Orem's paradigm describes nursing as therapeutic self-care designed to supplement self-care requisites. Nursing actions fall into one of three categories: wholly compensatory, partly compensatory, or supportive educative system. The nursing interventions Marjorie needs could be characterized as partly compensatory. While not having any rheumatoid arthritis flares, she's able to do most of her activities of daily living and many of the things she enjoys doing. Only her memory loss due to dementia necessitates her being in an assisted living residence. Marjorie's arthritis flare during the summer was treated by her primary care provider, who was also an advanced placement registered nurse, ordered a series of methotrexate injections, and her pain was managed with Norco 5-325s. A recent study of rheumatoid arthritis patients using Orem's model found that in a group which used Orem's intervention, training, coaching within the framework of self-care and treatment model for 3 months, along with and in tandem with rheumatologist treatment, patient pain was reduced. Rheumatoid arthritis in remission. During Marjorie's next visit with the advanced practice registered nurse, after the methotrexate series was finished, and along with extensive patient education during the period, her rheumatoid arthritis was greatly improved. She only had pain of a 2 or 3 out of 10, and the Norco 5-325s were only occasionally needed for pain. She was working on her crafts again, and her spirits were bright.